Hello and welcome. So today we are going to continue with the morphology of bacteria. So we are going to look at the gram-positive bacteria, and we may have gram-positive bacteria being cocci or gram-positive bacilli. And if it is gram-positive cocci, it may be aerobic or facultative anaerobic bacteria. It may also be what? Anaerobic bacteria. Now, if we say aerobic, it means they may thrive only under oxygenic environment which has oxygen, and facultative anaerobic means they may thrive in either conditions, whether there is oxygen or not. They may thrive. And examples of aerobic or facultative gram-positive cocci include Staphylococci, Streptococci, and Enterococci. Examples of gram-positive cocci, which are anaerobic, include the Streptococci. And when we say gram-positive cocci anaerobic, it means they thrive only under conditions where there are no oxygen. Then we have gram-positive bacilli, which may also be aerobic or facultative anaerobic, and they may also be gram-positive bacilli, which are anaerobic. So if it is gram-positive bacilli aerobic, examples we have Corynebacterium, we have Listeria, Nocardia, as well as Lactobacillus. And if it is gram-positive bacilli anaerobic, a typical example is Clostridium. Now we are going to pick them one by one, and so when we pick gram-positive cocci, which are basically aerobic or facultative anaerobic, the first one we can talk about is the Staphylococci. And so we have gram-positive cocci in clusters, as we've explained before, and we may also have what we call catalase positive. When we say catalase positive, we mean an enzyme present in the bacteria which is able to convert hydrogen peroxide into water and oxygen. So if we have such an enzyme, we say an enzyme found in the structure of the bacteria, we say it is catalase positive. Then we also have what we call coagulase positive. Now examples, so we may have coagulase positive and coagulase negative bacteria. So when we say coagulase positive, it is the presence of an enzyme which is called the coagulase. And this coagulase, what they do is they convert fibrinogen into fibrin. And so once we have fibrin, it causes clotting of the sample of blood that you have. And so if you take the sample and it clots after you have prepared it in the laboratory, then we say it is coagulase positive. But if the sample does not clot, then it means the bacteria does not have the enzyme coagulase, which is going to convert fibrinogen into fibrin, and so the sample may remain like that, will not clot. Examples of coagulase positive bacteria, we have Staphylococcus aureus, and this is the most important pathogen. Then examples of coagulase negative Staphylococcus, coagulase negative bacteria, we have Staphylococcus epididymis, which we may find as normal flora in the skin, and also we may have Staphylococcus saprophyticus. Now when we look at the gram-positive bacteria, we are going to now look at Streptococci. We've now seen Staphylococci. So let's look at Streptococci. So we may have catalase negative. So I've explained the catalase and other things already. So we may have gram-positive cocci in chains or in pairs, and as we've seen, these are called Streptococci. We are going to look at them under three main headings. So we have what we call the Streptococcus pyogenes, we have the Streptococcus viridans, then the Streptococcus pneumoniae. Streptococcus pneumoniae causes meningitis, sinusitis, otitis media, and pneumonia. So as the name implies, Streptococcus pneumoniae, the Streptococcus which causes what? Pneumonia. But it may also cause meningitis as well as sinusitis and otitis media. Then when we look at the Streptococcus viridans, it occurs in the mouth as normal flora, and it may cause endocarditis. And endocarditis, as I explained the last time, is the inflammation or infection of the innermost lining of the heart or the endocardium. Now, when we pick the Streptococcus pyogenes, an example of it is the group B hemolytic Streptococcus, and the most clinical important of this group of bacteria. So what they cause is they may cause pharyngitis, which is the most common. They may also cause cellulitis, which is acute inflammation of the subcutaneous tissue, and they are also responsible for rheumatic fever, which is characterized by fever, migrating polyarthritis, carditis, and some immunologic cross-reactivity. Then we also have acute glomerulonephritis, and in such children or in such patients, they may present with edema, hypertension, hematuria, as well as antigen-antibody complex deposition. Sorry. Then the third one we are going to look at is the Enterococci. An example of it is Enterococcus faecalis. Then we also have the gram-positive bacteria, which are bacilli in nature. We just finished looking at the cocci. Now we are looking at gram-positive bacteria, which are rod-shaped or which are bacilli in nature. And some may be spore-forming or non-spore-forming. Now we have the anaerobic, bacilli. Then we have the aerobic or the facultative anaerobic. When we pick the gram-positive bacteria, which are anaerobic, we have Clostridium tetani, which causes tetanus. We have Clostridium perfringens, which causes gas gangrene. Then Clostridium botulinum, which causes botulism. And this is characterized by descending weakness, paralysis, diplopia, dysphagia, and also respiratory failure in such patients. Other examples of gram-positive bacilli, which are anaerobic, include the Corynebacterium diphtheria, which causes fever, pharyngitis, and also some sequela of airway obstruction and myocarditis. Now, moving to the aerobic facultative gram-positive bacilli. These are the spore-forming bacteria, and the most important is the Bacillus anthracis, which causes anthrax or anthracis. The Bacillus anthracis has the only bacterial capsule that's made of polypeptide. And so these are some of the images of a patient having a gas gangrene. As you can see, it has made the skin darkened, as well as the subcutaneous tissue darkened. Then on your right, you can see the shape of the Clostridium tetani. And the Clostridium tetani and Clostridium botulism are both anaerobes, and what they do is they produce the same toxin. But what I need you to remember is that tetani's toxin inhibits the inhibitory impulses in the brain. Otherwise, botulinums or the botulinum toxin will inhibit the release of acetylcholinesterase. Now, on the gram negatives, we have gram-negative cocci as well as gram-negative rods. And common examples of gram-negative cocci, we have Neisseria gonorrhea, which causes gonorrhea in people. And so it is a gonococcus. Then we also have the Neisseria meningitidis, and this is considered as a potential pathogen in the oropharynx, and it causes meningitis. So the meningococcus is the one which causes this cerebrospinal meningitis, and they are all gram-negative cocci. So both of them are gram-negative intracellular diplococci, and we have example to be Moraxella cathalis. When we look at the gram-negative rods, we have enteric bacteria which ferment sugars. The most important ones we have E. coli, Salmonella, Shigella, Yersinia, and Klebsiella pneumonia, including Proteus. And these are the images that we find. Now, when we look at gram-negative rods, we also have what we call fastidious gram-negative rods. Examples, we have Bordetella pertussis, which causes pertussis, and we also have Haemophilus influenza, which may cause meningitis as well as some form of pneumonia. Then we have Campylobacter jejuni, then also Helicobacter pylori. Helicobacter pylori is the one responsible for peptic ulcer disease. Then we have Legionella pneumophilia, which causes some form of pneumonia. Then we have anaerobic gram-negative rods. An example, we have what we call the Bacteroides fragilis, and this is one of the anaerobes that resist penicillin, and so instead we should use metronidazole for its treatment because it's resistant to penicillin. Actually, it's an anaerobe, and so metronidazole works very well on anaerobe. Then we also have Fusobacterium as an example of the gram-negative rod anaerobic bacteria. Then we also have the oxidase positive gram-negative rods, and these ones do not ferment sugars. An example, we have the Pseudomonas, and these may cause infection in the immunocompromised patient. Then we also have the oxidase negative, an example is Acinetobacter species. And these ones, the most important example, we have the Vibrio cholerae that causes cholera. As we know, cholera is a disease which is characterized by severe diarrhea and vomiting. And so these are all examples of gram-negative rods. Now we have some non-gram stainable bacteria. And so these bacteria do not usually, stain. So we have the unusual gram positives, then we have the unusual gram negatives, and so they poorly, stain when we apply the grams. An example, we have the spirochetes, which are obligate intracellular microorganisms, and we have the mycoplasma. If you remember, we said the mycoplasma, they do not have any cell wall, and because they don't have a cell wall, they are unable to absorb the crystal violet when we apply them. An example of the mycoplasma, you have the mycoplasma pneumonia and the mycoplasma genitalium. We have other examples. We have chlamydia, rickettsia, borrelia, and the helicobacter. These are all examples of the poorly staining gram bacteria. And so this brings us to the end of our lesson. Thank you very much for your time.